Meet Pippa. Let's follow her as she goes through her rehab appointment. First of all, I just want to apologize for this late night DJ voice that I'm having right now. I'm starting to get a little bit of a cold, so bear with me. So Pippa has actually been coming to care since 2022, first for arthritis, intervertebral disc disease, and bilateral partial cranial cruciate ligament tears. However, in December 2025, she actually herniated a disc and needed a hemilaminectomy surgery, hence why her back is shaved. While we're still working on her other chronic conditions, we're now focusing on strengthening her limbs so she's not as wobbly when walking. So as you saw earlier, I was first assessing Pippa's gait to see how she's doing. I did a nice exam on her, and now I'm putting acupuncture needles in. And there are some areas where you can tell that she's a little bit sore, but she's actually doing really, really well for acupuncture. Now let's head over to her animal physical rehab session. So here, the assistant is icing her elbow. She had a traumatic fracture of her left radius and ulna that caused her to be chondrodysplastic, which essentially means that she has ballerina legs, and that caused arthritis to develop in her elbows. So there's thickening and swelling in her elbows, so we are icing her elbow at this point to help reduce the inflammation. Next, she's doing an exercise called active hip extension. So with an arm braced in front of her hips, we are having her extend forward and essentially helping improve her hip flexibility and strength. Lastly, she's doing an exercise called treat series. So here we use a treat, and actually a lot of treats, to help her go from one shoulder to the other. And this will help with weight bearing, stretching her neck, and engaging her muscles. Pippa is an excellent patient, and we are so happy with the progress that she's made so far since her surgery.